Imagine you are an oncologist. One day, a pale, swollen-looking elderly patient walks into your clinic. After taking his medical history, you discover that he is a 65-year-old man with advanced HCC. More importantly, he has not responded to TACE treatment, the standard first-line therapy for this condition. Desperate for help, he has come to your clinic. If you were the doctor, what would you do? Many people might have their own answers, but our doctor recommended a new immunotherapy drug called Imfinzi. Today we are going to talk about Imfinzi to help everyone, especially those with hepatocellular carcinoma, understanding this potential treatment. We will focus on two main questions. What is Imfinzi, and how can it help the cancer patients? First, what is Imfinzi? You might know that Imfinzi is an immunotherapy drug used to treat several cancers, but how does it work? What is the immunological mechanism behind it? I will explain this in simple terms. Let's start with the name Imfinzi. We are not just focused on the brand name, but also the drug name, Durvalumab. The suffix mab stands for the monoclonal antibody, and the U indicates that it is a human-derived antibody. This naming convention was used before 2021, and since Imfinzi has developed earlier, it follows the old rules. This means it is a lot of same antibodies that target a specific protein and block it effectively. So, the next question is, what protein does it target? How does this protein affect the cancer treatment? And does blocking it improve the treatment outcome? Before we delve into these questions, please allow me to briefly explain how our body fights cancer. The process of fighting cancer in our body is much like a battle. We can observe these two illustrations, which primarily depict the battle between T cells and tumor cells. Specifically, T cells act like a police officer, recognizing tumor cells through T cell activation receptors and initiating their destruction. However, tumor cells do not sit still. They often do disguises to evade detection by T cells, thereby preventing their own destruction. This disguise is a protein called PD-L1, which is the target of our monoclonal antibody. By blocking it, we essentially remove the tumor cell's camelot, exposing these villains. Consequently, T cells can perform their immune function effectively. Now that we understand the immunological basis of how Imfinzi works, but how about the practical results? Let's delve into the clinical trials. In a recent study published in the New England Journal of Medicine in 2022, researchers combined Imfinzi with another immunotherapy drug, Imjudo, in patients with refractory HCC. The combination successfully achieved tumor treatment and remission. Compared to the standard treatment with Durvalumab, this combination therapy results in a longer median survival time, meaning that it helps extend the life of tumor patients. More importantly, over 20% of patients observed tumor shrink with the new drug, compared to only 5% with the standard treatment. Furthermore, Imfinzi achieved tumor shrink more quickly with longer duration of tumor remission. According to the latest results from the drug company, 25% of refractory HCC patients retreated with the Imfinzi and Imjudo combination were still alive in the next 4 years, which is a significant improvement over traditional treatments. Lastly, almost everyone wants to know about the side effect of the Imfinzi. It must be acknowledged that, as an immune activator, Imfinzi has several side effects. It may activate immune response in other parts of the body, leading to rash, stomach pain, muscle pain, indigestion, and more. However, these side effects are generally manageable and outweighed by long-term benefits. In summary, if you experience any of these symptoms while using Imfinzi, please contact your doctor immediately. Early management of side effects can effectively reduce their impact. With all those above, I believe you now have a comprehensive understanding of Imfinzi. Thank you all for your attention, and I wish all patients a swift recovery and a life free from the danger of the tumors.